Hello friends, I'm Dr. Arshad Nadimawan with my ultrasound teaching videos. Hope you're all doing great, hope you're all enjoying the life and hope you are enjoying my videos as well. Last time I have discussed about the biliary tree imaging, how we will appreciate it on the images, how we'll characterize the lesion and how we'll come to the diagnosis. But the reporting part was not included. Today I'm going to discuss about how to write the report, how to conclude the diagnosis and how to make a differential. So let's start watching biliary tree reporting. Biliary tree reporting is as important as its imaging. So therefore must pay attention to the lesion, its characteristic and define it as you have seen on the images. Just to review a quick anatomy, gallbladder, cystic duct combine upward with the right and left common hepatic duct, and then downwards common bile duct which associate with the pancreatic duct as well. Biliary tree normal report should have the information regarding the CBD measurement or the normal CBD measure within 3 to 6 millimeter and mention that there is no stone, no mass, no polyps, lesion seen. Intra and extra biliary channels are not dilated. So this is the clear report, this is the normal report. If everything is normal, mention in this way, mention CBD, mention intra and extra biliary hepatic biliary channels. A quick review for the image. In this image you can appreciate pancreas, and alongside the pancreas and superior to the CBD there is a well-defined cyst and it is anechoic. There is no internal content. What you need to do is you have to measure the cyst and then you have to mention the location for that, and then at the end you should give your own diagnosis. So now let's go and watch how we will document this image on the report. On the report, it would be mentioned as a well-defined cyst measuring whatever the measurement is. You have to mention that is seen in the superior to the CBD. However, no stone or mass seen within the CBD. You can also write down that the lumen of the cyst was clear and there was no intraluminal debris or echogenic foci. At the conclusion, write down cyst at the superior proximity of the CBD with possible differential of the choledochal cyst type 1. Another image, you can appreciate a well-defined cystic lesions adjacent to the gallbladder. Beside this you can see the superiorly there are multiple cystic lesions also within the liver size, and you can also see the dilated CBD in it. So how we'll write the report? We'll have to write the report in this fashion, that the CBD is tortuously dilated and shows multiple cystic lesions. You have to measure the largest one, largest size is this and that. Intrahepatic biliary channels are also tortuously dilated. So for the conclusion of this report is that intra and extra biliary channels dilatations suggestive of choledochal cyst type 4. Further radiological imaging is recommended, as we have discussed about the choledochal cyst. So cyst 1, cyst 4 and cyst 5 can be easily appreciated on the ultrasound imaging, and this would be the report. Another lesion you can appreciate, this is the liver, and within the liver there is entirely biliary channels are tortuously dilated. So you can well appreciate these are small cystic lesions of the liver, and this would be a Caroli disease. So how we will write the report now? Report would be like this, that intrahepatic biliary channels are tortuously dilated. However, no stone or mass seen in the lumen. CBD measure within the normal limit. No extra biliary channels are dilated. So conclusion would be features are suggestive of Caroli disease. As I mentioned that in the Caroli disease there are particularly intrahepatic biliary channels dilatation. Extrahepatic channels will be alright. There will be no CBD dilatation and there will be no other extra CBD problems. So this is the typical feature of the Caroli disease, and you have to write this way. Another quick review of the image, you can appreciate a well-defined echogenic calculus. You have to measure the size. This is within the CBD and especially within the proximal CBD. So the proximal part, distal to the proximal part CBD is dilated. So now we are going to look how we will write this on the report and how we will write the diagnosis. Writing report for the stone within the CBD. we will write and mention that a calculus measuring 9 mm or whatever the size is seen stuck in the either proximal or distal CBD. You mention the location, causing dilatation of its proximal or distal part. Intrahepatic biliary channels are not dilated. Gallbladder stones are also seen, or if it is not present, so mention it is not seen, it might be slipped within the CBD. So that's why I conclude it as a choledocholithiasis. This is another image. You can appreciate the distended gallbladder within which there is some echogenic material, and you can, beside this, you can also appreciate the dilated intrahepatic biliary channels with the same characteristics. So this is actually post-traumatic imaging, and this is likely blood product or blood clot within the gallbladder and within the CBD. So let's come to look how we will write and mention it on the report. So the report would be like this, that the gallbladder shows low level internal echos with echogenic layers. Extra hepatic channels also shows intraluminal echogenic material. However, no stone is noted. So the conclusion would be, keeping the history or previous history of biliary intervention in view, ultrasound findings are suggestive of hemobilia. So with the hemobilia, there will be definitely previous interventions to the CBD or to the gallbladder, or some surgical intervention would be. So therefore, you should have to take the history of the patient and then look for the images and then document it on the report. So this was the classical report of the hemobilia. This is another image due to the post interventions hepato-biliary system. Sometimes the air leaks or travels within the biliary intrabiliary channel, and it will appear on the images like this, and you will appreciate linear echogenic lesions within the liver parenchyma, and it will cast aqueous shadowing, which will not be clear. This would be a dirty aqueous shadowing. On the report, it would be mentioned as liver parenchyma shows multiple reflective linear shadowing within the intrahepatic biliary channels, causing dirty aqueous shadowing, likely air. Conclusion would be, keeping the history previous biliary intervention in view, ultrasound findings are suggestive of pneumobilia. As I mentioned, there must be a previous intervention, so always take the previous history of the patient, and then whatever you have seen on the images, mention the mention the characteristic of the images on the report, and then give your conclusion. And if you have any suspicion, you can write down on your report that clinical lab correlation would be suggested, and further radiological imaging would be very helpful for the further diagnosis. This is another image in which you can see intrahepatic biliary channels, but you can appreciate very clearly because this is a magnifying view, so you can see within the lumen there is a intramural wall thickening, and that could be because of many other reasons, and that is a classical case of the cholangitis. So now the point is how you will mention it on the report, and how you will conclude it, and how you will advise if there is any next investigations. So the report would be that intrahepatic biliary channels are dilated and shows intraluminal thickening, causing narrowing of the channels. Mention whether there is any stone, sludge or mass lesion within it, or if not, so just mention only it was dilated with intraluminal wall thickening. And conclusion would be dilated intrahepatic biliary channel with intraluminal mucosal thickening, causing narrowing, suggestive of sclerosing cholangitis. This is actually ultrasonic finding. So for further workup, you have to write and mention on the report that further radiological imaging is recommended, so to correlate the ultrasound diagnosis. Another important investigation, especially in the Asian culture, is ASCARIASIS. This worm you can see very clearly within the lumen of the gallbladder, and sometimes you can appreciate this within the CBD. Here you can see linear echogenic shadowing within the lumen of the CBD, and CBD is also dilated. So now how you will write the report and how you will document all these findings. The report would be like this, that the CBD or gallbladder is dilated and shows echogenic parallel lines within its lumen, most likely suggestive of Ascaris lumbricoid. In the conclusion, you have to mention parallel echogenic lines within the gallbladder or CBD lumen, most likely Ascaris lumbricoid. Clinical lab and other radiological imaging correlation is recommended, because whenever there is ascariasis, so you can find multiple different sort of a cells, especially eosinophil on the blood count. You can also advise the stool RE, in which you can find the ova of the ascariasis as well, or even sometime you can see ascariasis itself in the stool. So therefore further imaging must be advised on the report. This is another image a bit tricky, because you can appreciate a well-defined large hypoequic, to some extent hypoequic mass with a clear boundary within the right lobe of the liver. So you have to look for the size, you have to mention the echogenicity of the lesion, and you have also document on the boundary as well. Beside this, you should have to mention about the intrahepatic biliary channel dilatation. However, it's not visible in this report, but that was classical case. So now look for how we will write the report for this. The report should mention that a well-defined mass measuring whatsoever the measurement is seen in the right lobe of liver, associated with biliary channel dilatation, biliary channel dilatations. Vascularity is noted on Doppler imaging. In the conclusion, intrahepatic mass with dilated biliary channels. Further radiological imaging is suggested to rule out intrahepatic cholangiocarcinoma. Intrahepatic cholangiocarcinoma, as I mentioned, that cholangiocarcinoma is of three types: intrahepatic, intraductal, or hilar region. And the differentiation between the hepatocellular carcinoma and the cholangiocarcinoma is that within the that in cholangiocarcinoma there will be intrahepatic biliary channel dilatations, while in hepatoma there will be no intrahepatic biliary channels dilatations. This is the classical image of intraductal mass, especially within the CBD. You can appreciate a well-defined, small, tiny hypoequic mass. You have to measure the mass and also measure the dilatations of the CBD and mention it on the report. The report should include that a well-defined polypoidal mass lesion measuring this much, whatever the measurement is seen in the CBD, and dilated biliary channel. It may occur in both area, within the CBD or within the dilated biliary channels. So also put the Doppler on it, and no vascularity is noted on Doppler imaging, and if there is any vascularity, mention that the vascularity was seen on the Doppler imaging. In the conclusion, intrahepatic intraductal mass with dilated biliary channel. Further radiological imaging is suggested to rule out intrahepatic intraductal cholangiocarcinoma. So again I will revise. Cholangiocarcinoma is of three types: intrahepatic, intraductal, and at hilar region, and the report would be like this, which I have mentioned here in this report. Look for this image. This is a image of hilar region mass. This you can appreciate a well-defined small mass, hypoequic echo structure, and a round in shape. So mention its location, that small mass is seen within the hilar region, and this is a classical example of the hilar cholangiocarcinoma. And you can also appreciate intrahepatic dilated biliary channel. So now look how we will document it on the report. So your report should have this information, that a well-defined mass measuring whatever the measurement is seen in the or at the hilar region. Hilar region of the liver, or the liver hilar region, is called as a portohepatis. You can straight away mention in the portohepatis. Vascularity is noted on Doppler imaging. So conclusion would be like this: hilar region or portohepatic mass with dilated intrahepatic biliary channels. Further radiological imaging is suggested to rule out hilar region cholangiocarcinoma. It is very vital to mention the diagnosis. It's very important. You must have to mention whatever you think are like your knowledge should be updated, and you must know that these are the differential and this is the clear-cut diagnosis. If in case of any doubt, you must mention that further radiological imaging is suggested to rule out whatever you have in your mind, and mention it on your report to help your colleague, surgeon, or medical professionals. Yes, friend, this was all about the biliary tract reporting. I included the imaging as well, so that just to review the knowledge, and keeping all these images in view, how we will write the report, how we will document whatever we have seen on the images, and how we'll reach to the conclusion. And if in case of any doubt, we will advise for the radiological imaging for the correlations. So this was what all about, and I'm sure you will enjoy this lecture, and you will take some information from all these videos. My next video would be for the liver, and as you know, liver is a big organ, largest organ. So I have divided all these videos into different components, and keep watching my video. And if you have any query or any suggestion, just email me and I will get back to you. So keep watching videos. See you then next time. Bye.